all clinicians, whether they're in the convenient care setting or they are in a doctor's office and working, or in their own clinic, a complete medication review is important. And compliance to their therapeutic regimen. Are they taking the medications? We have to kind of know where that patient is financially. They may not be able to afford any medication, or topical is it. So we have to decide what can we do to help those patients. So you have to know that. The other piece is being sure that they're up to date on their vaccines. That part is even more important because as a patient may progress to worse psoriasis, so there's mild, there's moderate, and severe. Mild we can treat with the corticosteroids and the sunlight, and then as we progress and we get into different therapies, medication-wise, there are live vaccines that cannot be given to those patients. So we want to make sure that all of their vaccinations are up to date, and we test them for TB, and for tuberculosis, or like a PPD testing, so that we know that, one, they're negative, and then that's recorded, and we would check that probably on a annual basis, and then give the vaccines accordingly. So those are probably the bigger ones. And then considering cost, and then early recognition of disease process. So do they have a history of hypertension, diabetes, cholesterol? Do they have autoimmune deficiencies such as Crohn's disease or inflammatory bowel? If we can interact with those patients and keep them compliant and under control with those disease processes, we can keep the psoriasis at least a little bit, more controlled. So I think it's just a really good, strong medical history and medication review is important.